So picking up in class where we were looking in the endocrine system, we were beginning to talk about the hypothalamus. So the hypothalamus is part of the central nervous system because it's part of the brain, but it's also part of the endocrine system because it secretes or makes hormones. And these hormones act on the pituitary gland. Okay, so they control or regulate the pituitary gland. So the hypothalamus, we're going to see how it controls the pituitary gland. It also controls a portion of the adrenal gland, the adrenal medulla, through sympathetic nerves. So remember, sympathetic nerves are part of the sympathetic nervous system, which is your fight or flight, which is one of the branches of the autonomic nervous system. Remember, the other branch was the parasympathetic nervous system, which is rest and digest. So we talked about that previously when we did the nervous system. And it also makes specific hormones. So we're going to see exactly how it works. So the pituitary gland has two different lobes. These lobes are controlled and work totally differently. So the anterior pituitary is under hormonal control. Remember, we started talking about the endocrine system. We said there are three ways that an endocrine gland will secrete. It may secrete because a hormone tells it to. We said neural stimulation or humoral, a change in the blood. So again, this is based on a release of a hormone. So it's through what we call a portal system. Anytime you have a portal system, what that basically means is an artery is going to a capillary bed. Okay, typically that capillary bed would be drained directly by a vein. But in a portal system, you're going to have another vessel, typically the portal vein, which is going to carry it to another capillary bed, and then it's going to be drained by the vein. So that's what we have, the relationship between the pituitary gland anterior and the hypothalamus. And so it has hormones that it's going to make. If it wants to stimulate the anterior pituitary to release one of the hormones, it's going to secrete a very specific releasing hormone. If it does not want it to make a particular hormone, then instead it's going to secrete a inhibiting. The posterior is under direct control because the hypothalamus actually makes the hormones and they are simply stored within the posterior lobe. Okay, so again here it's illustrating the relationship that we have. So again, in the anterior pituitary system, you see that releasing or inhibiting hormones are made within the hypothalamus. Okay, they enter the bloodstream through the capillary bed. They're carried to the capillary bed within the anterior pituitary. Okay, if it's releasing, it's going to make some of these specific cells make a specific hormone, which will then be released into the blood. If it's an inhibiting hormone, it will stop the secretion of those cells. The posterior is under direct control. So these neurons are actually making the two hormones that are stored in the posterior. They're carried by axons to the posterior lobe. When they're ready to be released, they will then enter the bloodstream from the posterior. And then over here we see the relationship of the sympathetic nervous system. So these are axons from sympathetic neurons that are innervating the adrenal medulla. So when the sympathetic system is triggered, we are going to release epinephrine and norepinephrine into the blood. So any of the cells that have receptors for norepinephrine and epinephrine will start to exhibit these sympathetic effects. Again, we talked about that in the nervous system. Okay, so now we're specifically going to look at the anterior pituitary and the different hormones that it secretes. So we call several of these hormones tropic hormones. Okay, Okay, because these are hormones that are stimulating another endocrine gland to secrete a hormone. So we have 4 different types of tropic hormones. The first is what we call thyroid stimulating hormone, or TSH for short. Okay, on the exam, I will be sure to have the full name of the hormone as well as the abbreviation. So this stimulates the thyroid gland to make thyroid hormone, or TH. Then we have ACTH, which stands for adrenocorticotropic hormone. Okay, so earlier we talked about the adrenal gland. Okay, the adrenal gland is a triangular shaped gland that is directly above the kidneys. And you can divide it into 2 different portions. Okay, the cortex is just this outer portion. And the cortex is what is stimulated by adrenocorticotropic hormone. Okay, the medulla we talked about previously, that is the inner portion. And it's controlled by sympathetic neurons of the autonomic nervous system. Okay, our next 2 tropic hormones are in a group called gonadotropins, okay, because they specifically stimulate the gonads. Okay, so the gonads are your male and female reproductive organs. So the female is going to be the ovary. Okay, the male gonad is going to be the testis. Okay, so we have a type of endocrine dysfunction here. So it's hypogonadism. Remember, hypo is too low. So you're not making enough of these gonadotropins. So what that means is that you would not be stimulating the ovary, and you would not be stimulating the testes. So the ovary is where you would be making the sex hormone estrogen. Testis is individual, plural testes is where the male makes testosterone. Okay, so if you do not have these 2 gonadotropins, FSH and LH, you would not be able to become sexually mature. And FSH stands for follicle stimulating hormone. LH stands for luteinizing hormone. Okay, we will talk later in detail about these when we cover reproductive system. Without these 2 hormones, though, you do not stimulate the ovaries to produce estrogen or stimulate the testes to produce testosterone. So that's what leads to hypogonadism. Okay, the anterior pituitary also makes some hormones that are non-tropic. So all that means is these target cells are not endocrine cells. So prolactin, or PRL, stimulates the mammary glands to develop. Basically, when a woman's pregnant, it's going to help start to produce milk. We call this lactation. The other non-tropic hormone made by the anterior pituitary is GH, or growth hormone. Sometimes this is also HGH, human growth hormone. This stimulates many cells in the body to increase the rate of protein synthesis, which basically means they're also stimulating the rate of cell division, or mitosis. Specifically, skeletal muscle cells are very sensitive to growth hormone, chondrocytes, cells within cartilage, and osteocytes as well. Okay, so some homeostatic imbalances when the amount of growth hormone is too much or too little. When it is not produced in sufficient quantities, it can cause pituitary dwarfism. Typically, why pituitary dwarfism, the pituitary gland is not stimulating the anterior pituitary to make the appropriate amount of GH. This is what we technically call little people. Usually you're talking about individuals 4'10" or smaller. Too much, so hypersecretion. Okay, so this was hypo. Hypersecretion can cause two different disorders. If it occurs during childhood, it will cause gigantism. Basically, in these individuals, everything will be very large, very big, and pretty much in proportion. It's not uncommon for these individuals to be 6'5", 7 foot. Acromegalia is when GH, increased secretion, only occurs as an adult. So they've already reached their height mature-wise, so really what it's stimulating are facial bones. A lot of times you'll also see enlargement in the hands and feet area. So it would be a disproportionate when the body is getting large in specific areas. Okay, so now we're going to switch and talk about the posterior lobe of the pituitary gland. Again, just to remind you that these hormones are synthesized or made by the hypothalamus. They are just simply stored within the posterior lobe. So we have ADH, which stands for antidiuretic hormone, and OT, which is oxytocin. So again, you have neurosecretory cells that are in the hypothalamus that send the secretions to the posterior pituitary, where they can then be released within the blood system. So the effects of these two hormones. Antidiuretic hormone is going to help increase blood pressure or blood volume. So BP here stands for blood pressure. BV stands for blood volume. Okay, so when it is too low, that would cause the posterior pituitary to release the ADH that it's making. So it's going to help increase electrolyte concentration. The more electrolytes you have, specifically sodium, potassium, that's going to help the body also retain more water. And again, as we said, a decrease in blood pressure would stimulate the production of this, or a decrease in blood volume. Blood volume is the amount of blood in the body. Anytime you have a decrease in blood volume, you will directly also see a decrease in blood pressure. So how does ADH increase the amount of water in the body, therefore increasing blood volume and blood pressure? It increases the amount of water that the kidneys reabsorb or allow to bring back in to the blood system. So it decreases the amount of water that we eliminate through urine. Oxytocin target is going to be smooth muscle. Specifically, we really see this in two areas. In the female, it's going to help stimulate the smooth muscle in the uterus. This is going to be really important when she's delivering the baby. In fact, a lot of times to induce labor, they'll give women a synthetic form of this, Pitocin. And then also it's going to stimulate the smooth muscles within the mammary glands. This is important. It basically allows what we call the milk letdown reflex. So prolactin stimulated the mammary glands to secrete the milk. But without oxytocin, the milk will not actually be able to be released in the ducts and therefore be made available to the infant. Okay, so now we're going to talk about a few other endocrine glands. So first of all, the thyroid gland makes two different hormones. It makes what we call thyroid hormone TH, which is actually made of a combination of T3 and T4, as well as calcitonin. There are two different types of cells that make these hormones. Thyroid hormone is made specifically by the thyroid follicles, where calcitonin is made by what we call the parafollicular or C cells. What triggers the thyroid follicles to make thyroid hormone, that's going to be our thyroid stimulating hormone. Okay, so an increase in TSH will increase the production of TH as well. Okay, so if we look at the thyroid gland, we see that it sits just below the larynx. So this is your larynx. It's a bilobe structure. Okay, so then we're going to look at a microscopic view. So basically you're looking at two different types of cells here. The cells that form these round structures, basically made of the simple cuboidal, those are your follicular cells. Okay, so this is where the TH, thyroid hormone, is going to be made. These cells here, these are the parafollicular or C cells where calcitonin is going to be made. Okay, so what does thyroid hormone and calcitonin do? Well, thyroid hormone target is almost every nucleated cell in the body. And its main function is that it increases cellular metabolism or increases the rate of chemical reactions in the cell, therefore increasing the productivity of the cell. So without sufficient amounts of thyroid hormone, you will not see normal development of skeletal muscle or the nervous systems. So the disorders that occur with thyroid hormone, we have hypothyroidism. Again, hypo means low amounts. So this is when we do not produce enough thyroid hormone. In infants, this causes creatinism, which basically is an underdevelopment of the nervous system and the skeletal system. So you see suppressed development, neurological issues, issues controlling movement. In adults, their nervous system and skeletal systems have already developed normally, so you see different symptoms. You see that they're very tired. Okay, again, if you're not making enough thyroid hormone, that means your cellular metabolism is low. So your cells cannot make as much ATP. They can't make as much ATP, which is energy. Your body's not going to be able to work in as high of capacity. So when you get cold, typically we would stimulate the skeletal muscles to contract. And we know that this requires ATP energy. So they get cold very easily. And a lot of times they will also develop what we call a goiter, which is when the thyroid gland itself enlarges. So basically the body senses that the TH levels are too low. It tries to increase the amount of thyroid hormone being produced, but it's just unable to meet the demands of the body. Okay, so in these two pictures you see creatinism here on the left. So again, you see some neurological slow development. That's why the baby has those the eyes, the mouth, things like that are not normal. And of course here we see the very enlarged thyroid gland indicating a goiter. Okay, so the other homeostatic imbalance of TH is hyperthyroidism. This is when too much thyroid hormone is being made. Typically, this is when you have a tumor on the thyroid gland. So remember, tumor is when you have cells that are uncontrollably dividing. So these follicular cells, you have too many, therefore too much thyroid hormone. So this causes the metabolic rate of your cells to be extremely high. Okay, so you have a very high body temperature. Your cardiac activity is being stimulated too much. The nervous system is being stimulated too much. And the point that the person actually feels it difficult to relax, so they feel restless. They'll typically get very moody, irritated very easily. These individuals are also easily fatigued because even sitting there or simply doing basic things like walking, they're consuming so much more, or they're burning so much more ATP. So these individuals must consume a lot more food to not be fatigued. And then many times this is caused by an autoimmune form, which is when the body cells are actually attacking cells within the thyroid gland, and in this case we call it Graves' disease. The other hormone was calcitonin, okay? And calcitonin is a hormone that helps regulate the amount of calcium in the body. So we have to have calcium for nerves to send impulses. Okay, if you remember, if we look at a neuron, okay, and I'm drawing the axon terminal. Okay, calcium is what is going to enter the axon terminal, and that's what's going to make the axon terminal release the neurotransmitter. Okay, that would then stimulate other neurons or muscle cells, okay, depending on what type of synapse it is. So calcium concentrations also affect the amount of sodium that can therefore cross the membrane. And we know that sodium has to be able to enter cells to cause depolarization, which, if that occurs at the threshold value, will excite the membrane. So that will allow a nerve impulse to occur or a muscle to contract. Okay, so two hormones that play a role in regulating the amount of calcium in the body. So you have calcitonin. Okay, calcitonin is made by the C cells. We also said those are called parafollicular cells in the thyroid gland. So whenever you have increased amount of calcium in the blood, that's when you're going to make calcitonin. So calcitonin will help decrease the amount of calcium in the blood. Okay, so because the stimulus was an increase, the cause is a decrease. This is, of course, the type of negative feedback, like most processes in the body. Okay, so how does it decrease the amount of calcium in the blood? This is actually incorrect. This should be it increases the amount of calcium that's uptaked in bones, so bones can be stronger. And then if you still have excess, it's going to allow you to urinate the excess in the kidneys as well. Parathyroid hormone is the other hormone, okay, which can help regulate calcium levels. It has the exact opposite effect of calcitonin. So we say the effects are antagonistic. Okay, it is produced by what we call the parathyroid glands. So if we were to look at the thyroid gland from a posterior view, most people have 4 small little globular units here. Those would be the parathyroid glands. And again, this has the opposite effect. So when calcium levels in the blood are too low, we're going to release parathyroid hormone, and that will increase the amount of calcium in our blood. Okay, so again, this is just showing the posterior pituitary, and again, the purple areas that you see here, that would be the parathyroid gland where the parathyroid hormone is made. And remember, the thyroid is where we make the other hormone that controls calcium levels, which is calcitonin, versus the production of PTH. So both are very close. And again, we're looking at calcium levels in the blood. So both of these hormones are released based on a humoral response. So remember, humoral refers to when levels in the blood or other fluids of the body decrease or increase. Okay, so how does the parathyroid hormone work? And actually, if you're comparing parathyroid with calcitonin, the effects of parathyroid are much more significant. We did briefly talk about this in skeletal system. So it's going to stimulate cells of the bone, osteoclast. Remember, osteoclasts are going to break down bone. One of the main minerals stored in bone is calcium. Okay, so as they break down the bone, calcium is released, and so the amount of calcium in the blood is increased. So it decreases in bone, it increases in blood. So it's going to inhibit the cells that would actually take the calcium and store it in bone, which we call osteoblast. It's also going to increase the amount of calcium that we are reabsorbing in the kidneys. Okay, so you will not be urinating out any. You should be keeping that in your body by reabsorbing it in the blood. It's also going to stimulate the formation of calcitriol. Okay, calcitriol is the active form of vitamin D. Remember, vitamin D is necessary to absorb calcium from the foods that we eat in our diet. Okay, so this allows us to increase the amount of calcium in our digestive system. Okay, so this illustration is basically showing the different effects specifically of parathyroid hormone. Okay, so again, you see that they're actually using the red here to indicate the hormone. Okay, so the effects on bone is that it's going to break down the bone. Okay, therefore increasing the amount of calcium. Calcium is shown here with the black. In the intestines, it's going to increase the amount of calcium we're absorbing from food. Of course, mainly this is going to be dairy products. And it's going to increase the amount of calcium that we are returning back to the blood, not urinating out in the kidneys. Okay, so in all three of these ways, it's going to increase the amount of calcium in the blood. Okay, so right next to the kidneys, we have the adrenal glands. Okay, so ad actually means above, and of course we do see this is directly above the adrenal glands. It's also superior to the kidneys, and of course renal refers to kidneys, so the other name that we use for this is suprarenal glands. This, of course, is showing the picture that I kind of showed earlier, indicating the two major regions or areas of the adrenal gland. So you have the cortex, which is the outermost region. Okay, that's going to be stimulated and produces its own hormones, as well as the more central portion, the medulla, which we already talked about briefly earlier. This portion is actually showing that in the cortex, you actually have these three very specific regions. Okay, and each one of these regions is going to make different hormones within the adrenal cortex. Okay, so at this point, you actually don't have to know the names of the layers. I just want you to know what specifically is being produced. So specifically, all the hormones, kind of a general name for them produced within the adrenal cortex, they're called corticosteroids. Okay, cortico because the cortex, they are a type of steroid. Remember, steroid is going to be a lipid or fat-based hormone. So the outermost layer produces what we call mineralocorticoids. Okay, the middle layer produces glucocorticoids. And then the innermost layer would produce gonadotropins, also sometimes called gonadocorticoids. Okay, so we're going to look at what do each one of these types of corticoids do. So mineralocorticoids, there are several different types. Okay, what they do is they help regulate the electrolyte balance. So the electrolyte are how many minerals or salts ions, okay, potentially are in the body, as well as how much water that we have. The main type of mineralocorticoid, and the only one we're going to talk about specifically, is aldosterone. So aldosterone, where its receptors are, the target are going to be tubules in the kidney. So what it's going to do in the kidneys, it's going to increase the amount of sodium or salt. Remember, sodium plus chloride equals salt that we're going to be reabsorbing, okay, keeping in our blood, not urinating out. This is a part of a very important mechanism. We'll revisit this mechanism when we talk about the urinary system. It's called the renin-angiotensin mechanism. And basically, this is a process that begins in the kidneys when the amount of blood pressure is too low. Or blood pressure would also mean that blood volume, the amount of fluid in the body, is too low. So the kidneys will produce renin when blood pressure is too low. Several things are going to happen. One of the things that's produced through renin, eventually another hormone called angiotensin 2 will be released, and that causes aldosterone to be released. And again, aldosterone is going to increase the amount of sodium, okay, that we are reabsorbing. What angiotensin 2 is also going to increase the production of is ADH, antidiuretic hormone. And if you remember, antidiuretic hormone increases the amount of water that we would be reabsorbing. Okay, so by increasing the amount of water in sodium, we are going to increase the amount of fluid that we're retaining in the body, therefore increasing the amount of blood we have in the body, which would increase our blood pressure. Okay, the middle layer produces glucocorticoids. Several different types. Cortisone, hydrocortisone are two common types of this. They are referred to as anti-inflammatories. So they're going to inhibit inflammation. So remember, inflammation is the first step for healing the body. And part of healing the body, we stimulate white blood cells or leukocytes to come and engulf debris, possibly some infectious agents that entered there. Okay, specific types of white blood cells that eat like this, we call them phagocytes. So it's going to slow down the phagocytes and other white blood cells that are coming to the area. One of the white blood cells we talked about were mast cells, where mast cells release histamine, which is one of the main inflammatory chemicals. So without the production of histamine, you are going to decrease the amount of inflammation, okay, and therefore decrease the healing rates or suppress the activity of the immune system. So why we do this, localized inflammation can cause pain. Okay, we don't want the inflammation to be so much where it's causing pain. However, if you use glucocorticoids for a long-term basis, this is dangerous because long-term suppression of the immune system makes your body more susceptible to infection. And it's slowing down the healing rates to a point where you could start to see more scar tissue develop, sickly individual person gets very lethargic as well. However, the body naturally produces these when we are stressed for long periods of time, or what we call chronic stress. And again, that's why you see if you're stressed for a long period of time, you are easier to get sick and typically very tired. Okay, the last area, gonatosteroids or gonatocorticoids, is going to play a role in the amount of androgens or sex hormones that are produced. typically androgens are referred to as male sex hormones, which is testosterone, but testosterone and estrogen are actually chemically very similar to one another. So the body can remove some of the lipid protein components, and it can easily be converted to estrogen as well. Where we produce the most sex hormones are still going to be in the gonads, which are for the female, that would be the ovaries. For the male, that would be the testes. Okay, so typically we don't see levels here affecting whether or not the person's going to develop sexually. However, if the body in a male is converting too much to estrogen, it can cause the male to develop female-like breasts that you see here. We actually call that condition gynecomastia, which that may not be spelled right. I'm not the best speller. In the female, it causes an increased level of masculinization. You would have increased skeletal muscle, maybe some coarser hair production on the neck and the face, possibly deepening of voices as well. Addison's disease is a disease that occurs when you have an overproduction of these corticosteroids. So this could be in any of the areas. And we talked about this, I believe, with skin. Addison's disease on the skin would make the skin appear very orange, tan. Okay, the adrenal medulla, again, it's going to be controlled or innervated by neurons from the sympathetic nervous system, which arise from the hypothalamus. So again, when you have the E's that are occurring, something that makes you feel excited, embarrassed, if you're exercising, or if you feel an emergency situation, okay, these neurons are going to stimulate the secretory cells in the adrenal medulla to release what we call catecholamines or adrenalins. So that's going to be epinephrine and norepinephrine. Okay, so what does norepinephrine and epinephrine do? Well, you're going to basically increase the activity of the body. So to do this, that means the body needs more ATP. Okay, how do we get ATP? We have to take glucose and break that down and convert it to ATP. So we have to increase the amount of glucose that's in the blood. So the storage form of glucose is glycogen. We're going to break glycogen down, therefore increasing the amount of glucose in the blood. Where we store most of the extra glycogen is going to be in the liver and the skeletal muscles. Okay, so with more glucose, this allows our body to make more ATP, so it would allow you to have more strength and more endurance. Okay, so you can contract skeletal muscles for a longer period of time, and they would produce more force or more power. You also have more sugar that's available for the neurons. So obviously with increased physical activity, the brain has to increase coordinated activities as well. After the body's going to break down the blood sugar, glucose, for ATP, then it will start to use fatty acids to convert to ATP as well. So then you would increase the amount of adipose tissue that you're breaking down. Epinephrine and norepinephrine on the heart, it's going to increase the rate of the heart. So increases the rate is how many times the heart's beating. Force of contraction is going to be how much. Basically, both of these are going to increase the amount of blood that's leaving the heart, therefore is available to other tissues of the body, like skeletal muscle and the brain. Okay, now we're going to talk about the pancreas. Most of the pancreas is actually exocrine. Remember, exocrine are going to be glands that contain ducts. These exocrine glands produce pancreatic juice, which we're going to talk about with the digestive system. Okay, so right now we're just going to focus on the cells of the pancreas, which have more endocrine function. Okay, so they make hormones. This is about 1 to 5% of the cells in the pancreas. So these endocrine cells occur within these small circular areas in the pancreas, which we call a islet of Langerhans or a pancreatic islet. And you have two different cells here, and they make two different hormones. And these are going to help regulate blood sugar. So this is insulin and glucagon. The other hormones that it's talking about here, these are actually dealing with pancreatic juice, so that really probably shouldn't be under this upset. Don't really worry about that much. Again, when we get to digestive system, we will talk about that further. Okay, so glucagon raises the blood sugar or blood glucose levels. So that means it will be triggered to be released when blood glucose levels are low. Okay, so how does it increase the amount of sugar in the blood? It causes the cells in the liver, which we call hepatocytes, to break down the storage form of glucose, which is glycogen, therefore increasing the amount of glucose in the blood. Insulin does the exact opposite of glucagon, so it has an antagonistic relationship. So we release insulin when blood glucose levels are too high. Okay, so it lowers the amount of blood glucose in our body. How does it do this? It increases the amount of glucose that we are storing inside the liver and skeletal muscle cells. So again, we store glucose as glycogen. Okay, so some homeostatic imbalances we can see with this. Hyperglycemia, again, hyper is too much. That's when someone has too much sugar in the blood. And basically that means that the body is unable to lower it to its homeostatic or normal range, which means the person is unable to make insulin effectively. So it can start off as hyperglycemia, and it can end up being diabetes mellitus. Okay, so diabetes mellitus is when a person cannot make enough insulin, or the insulin is not normal. So basically it doesn't bind to the receptors and therefore cause the effect of lowering blood sugar, or something's wrong with the receptors. So again, you're unable to lower the blood sugar. Two different forms of diabetes mellitus. So type 1 we refer to as insulin dependent, which means the person must be given insulin to keep the blood sugar levels regulated. Usually, this is when people are very young. Typically, this is when the body is attacking its own pancreatic cells. This is usually an autoimmune disorder. Really, you don't need to know the name of the cells, but there are specific cells in the pancreas that make insulin, and this person has destroyed those cells. Okay, so again, they cannot take insulin. So whenever they eat or right before they eat, they have to take insulin, okay, to help regulate their blood sugar levels. Most people have insulin independent type. This is by obese individuals. We used to see it happen more in people over 40. However, we're really seeing the juvenile level increase here as well. And 90% of diabetic cases, especially in the United States, is this type. This is what I typically call diabetes induced. So this occurs when people do not exercise enough, or more commonly, or in conjunction with this, they consume too many sugars and carbohydrates. Okay, so within the brain, you have the pineal gland. Okay, so if I just draw a really rough area of the brain, brainstem, cerebellum, portions here. This was the hypothalamus. Okay, and you have the little pituitary gland in this region. This was our thalamus. The pineal gland is about here. It gets information from visual pathways. And of course, things that we see, we're going to be able to notice when we have light and dark. So when it's dark, which is obviously typically at night, that's going to stimulate the cells here to make melatonin. Okay, melatonin is basically what helps make you feel sleepy. So it does other things as well. It inhibits the amount of gonadotropins you're releasing, and basically while you're sleeping, it's protecting the CNS from oxidants. It's basically we are detoxifying the body at this time, and it sets what we call circadian rhythms, which are your sleep-wake cycles. So again, when it's dark, that's when we're going to secrete melatonin. Now, melatonin is also very similar to another type of neurotransmitter called serotonin. Serotonin is basically the body's natural happy drug. So if you don't produce enough melatonin, that can also make a person depressed, okay, because that affects the amount of serotonin that they can produce as well. Okay, so we've been focusing on glands, so basically the whole or major function of that particular organ or structure was to make these hormones. Well, you have these other tissues that just have some cells within there that are making hormones. So we're just going to talk about these briefly. So a lot of these we will talk about in further detail as we get to these different systems. So in the intestines, which of course is part of our digestive system, you have several hormones, which we refer to as peptide hormones, and serotonin, which are going to help regulate the motility or basically activity of the digestive system. In the kidneys, there are several different hormones. We've actually talked about 2 of these already. So again, calcitriol is the active form of vitamin D. Again, we can get vitamin D from the foods we consume as well as from sunlight that we convert in the dermal vessels. So the more parathyroid hormone that we secrete, the more calcitriol we're going to have. Remember, calcitriol, again, is D. Vitamin D helps us to absorb the amount of calcium. So we secrete parathyroid hormone when calcium levels are low. Okay, therefore, by increasing the amount of vitamin D, we can increase the amount of calcium that's in our blood as well. EPO is referred to as erythropoietin. It's going to stimulate the bone marrow to increase the amount of red blood cells or erythrocytes that it is making. Okay, if you increase the amount of red blood cells, you can increase the amount of oxygen that is going to cells. Renin, we talked about this briefly. This is part of the renin-angiotensin system. So again, the kidneys release renin when blood volume and therefore blood pressure is too low. Okay, so it's going to increase blood volume and blood pressure by causing an increase in ADH, which increases the amount of water that we absorb, and aldosterone, which increases the amount of sodium that we reabsorb. So the effects again of renin are an increase of blood volume and therefore blood pressure. The heart, we have a hormone called ANP. If you want to know what that stands for, it stands for atrial natriuretic peptide. And this hormone has the opposite effects of the hormones that we mentioned in the renin system. So when your blood pressure is too high, that means you have too much blood in the body. So one of the chambers of the heart, which is the right atrium, is going to be stretched when you have too much blood. Okay, when it's stretched, these cells within the right atrium will release ANP. So ANP will decrease the blood volume, and therefore blood pressure. Okay, so it does this by decreasing the amount of sodium that we have in the body and decreasing the amount of water. So again, the opposite effects of the hormones that are in the renin. Within the thymus, there are two hormones. We call them thymosins and thymopoietins. They are important in stimulating T cells to develop and mature. We will talk more about this when we do lymphatic and the immune system, which is what the thymus is part of. Okay, lastly, the reproductive organs. Again, I'm going to be very brief here because we will cover the reproductive system later. Testosterone is produced within the male gonads, which we call the testes. Okay, so testosterone is going to increase the development of sperm, which is the sex cell or the sex gamete that's produced by the male. Testosterone also ensures that basically the male reproductive tract will be healthy, that the male develops sexually, and we'll also talk about the effects of testosterone. It basically increases the metabolism. Two female hormones, sex hormones that are produced by the female gonad, the ovaries, you have estrogen and progesterone. So estrogen is going to be secreted when the two gonatocorticoids or gonadotropins are produced, FSH and LH. So estrogen helps a female to develop sexually during puberty. Normal female characteristics, increased fat in the breast and buttocks area. She starts to get the menstrual cycle. Progesterone is an important hormone regulating the menstrual cycle. Details we'll talk about later. Adipose tissue, which is fat tissue, two different hormones that we'll talk about. So when you consume a lot of fatty foods, the body produces leptin. And leptin basically binds to receptors in your brain that tell you that you're full or satisfied. Okay, so it's going to suppress your appetite or the amount of food that you want to consume. Resistin is a hormone which has the opposite effects of insulin. So remember, insulin is produced in the pancreas when blood sugar levels are high. Okay, so obviously insulin's going to lower blood sugar levels. So resistin does the opposite. Resistin's going to increase blood glucose levels. When you increase blood glucose levels, you will store more glucose as glycogen. Then once you finish that, you're going to store excess in fat. So basically, with increased amount of resistin, you're going to increase the amount of fats that you're storing. Therefore, increase the amount of adipose tissue. And that is the end of the endocrine system.